Well, today we're very pleased to have Dr. Pramod Sogani with us, and he is the incoming president. I guess at the end of this meeting, you'll be the president of the AUA, and he is at Memorial Sloan-Kettering and Cornell. We're going to ask several questions, Pram, about challenges facing AUA membership and maybe a few of your initiatives as you go forward this year. Starting with that, the primary concerns for the average urologist: ancillaries, CT scans, pathology labs, so pod labs, etc. Where do we stand on that, and how does the AUA look at these issues?
Well, Brent, AUA, as you know, covers every member, whether they are academician or practicing in non-academician hospital, or a small group or large group. So we look in a broad sense to all the members. And we know that we want to provide the best and efficient care to our patients. And in that regard, for the benefit of patient, if we can provide the best possible care, and that could be providing ancillary services in addition to the practice, that will be acceptable, and AUA supports that. What has been publicized in press is the negative aspect of it, and in order to that, AU has formed some guidelines, something to protect the members. And if we follow those guidelines, I think we are doing service to our patient, not disservice to the profession. So we all follow those guidelines. I mean, it's nothing new. Our members are ethically very sound and very professional, and it's a matter of reminding them. If you have a patient and if you own a ancillary service, it's always nice to educate the patient your interest that you do own a ancillary service. And so long it's transparent, so long you can say these are the benefit, and give them the opportunity to choose any place where they want to go. Explain them about their condition, explain to them about the options of treatment, explain to them clearly that they are open for second opinion, provide them places or physicians who can provide second opinion, and then so long you're transparent and patient understands that he has an option of going and seeking another medical opinion, and then if they go somewhere else, then you should be open that it will not jeopardize their care. They can come back to you. So I think we have to follow these guidelines, these simple ethical procedures.
Now, that makes perfect sense. It sounds like what the AUA really supports is those services to benefit in the most efficient way our patients, but also very ethical standards that the membership have to practice by. It makes perfect sense to all of us. So that's fantastic. What would you say your highest priorities as the incoming AUA president? What are your highest priorities for the coming year?
Well, I would like to advance what we already have achieved in the field of education, research, and advocacy. AUA is the leader in providing high quality education which is evidence based, and there is always a place we can enhance it in the coming year and in future. So that will be my prime objective. Having said that, you cannot achieve improved patient care unless we do research. Research is very critical, and today's research is tomorrow's practice, so we have to invest every effort in future for improving the urological research. Having said that, it's not easy. It's going to be challenging in this era of sequestration. The challenge will be to find the funding. So we have to improve our advocacy, our relationship with government, federal institutions, NIDDK, NIH, and NCI, and also wherever we can go and ask for funding, because all we have to do is we have to educate them that this is very important, this part, and if we can get some funding to research, that will be great. So that will be a big challenge, yeah. But we'll pursue this very seriously with the help of our Chair of Research, and we are in the phase of transitioning the Urology Care Foundation, and we are looking for the chair or the president of Urology Care Foundation. So we'll make every effort that the person who is selected for this important position will have enough resources to get enough funding for it.
Since you mentioned that, why don't we go a little further on the Urology Care Foundation? Not just a new name, but a new function, would you say? So you mentioned that they're looking now for a leader in that position. What would be the primary function of the UCF?
Well, your UCF, it has several functions. It covers the development to raise the fund for research. The Office of Research is now located under AUA ER. So, but the primary function of UCF chair will be to raise a fund for the research and help him in that regard. Of course, there are many other important functions. We want him to raise a fund for diverting for patient education, for outreach to the patient, and advocacy. So he will have multiple functions in that regard as a chair of the UCF.
Great. So there'll be a lot more philanthropy involved in the Urology Care Foundation coming forward.
That's right. I think that's one of the objectives of changing the infrastructure was to see if we can make this board as a philanthropic board and rather than physician board. And I think that will advance our mission, that if we can accomplish, he can talk to people who have the desire to give because of their close connection with urology.
Sure.
And he will be a good spokesperson.